Good morning, Las Vegas. Welcome to a Healthier Tomorrow radio show. I'm your host, Will Rucker, and today we have two fantastic women who are doing incredible work right here in Las Vegas for our community. You are definitely in for a treat. First up, we have none other than Alisa Howard of Minority Health Consultants. And then we have Miss Charlene Day, who will be sharing with us more about Community Partners for Better Health and the work that they are accomplishing, as well as her own work with her company. So stay tuned. Call a friend, let them know we are on the air. Health information is on the way. I want to let you know the Healthier Tomorrow radio program is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The Southern Nevada Health District is working with other partners to respond to the COVID-19 pandemic in our community. For more information about COVID-19, available community resources, or information about testing and vaccination, please visit the Health District's website, www.southernNevadaHealthDistrict.org, or call their information line at 702-759-INFO. That again is 702-759-INFO. I want to thank you for tuning into the show this morning. This is such an important voice for our community. Health is power. Health is wealth. Education is power. Education is wealth. And this show is about both. So thank you for tuning in to the show. Thank you for taking interest in your own health and the health of our community. Call a friend. Send an email, send a text, whatever it is, let them know the Healthier Tomorrow radio show is on the air. We've got two fantastic guests, Alisa Howard and Charlene Day, and they're both going to share vital information for our community that we need to know right now. So make sure your friends and family, neighbors are all tuned in to hear. All right, so let's welcome Charlene Day, who is the Executive Director of Education for Quality Living. Good morning, Charlene.
Good morning, Will, and thank you so much for having me.
I'm so glad you could join. You know, the journey here has been long, but we made it.
We made it indeed, and I am no stranger to the Healthier Tomorrow community. Celeste had me on numerous times, and it's such a pleasure to be able to be back and to start off this new year on the good foot.
Absolutely. This is the time of year when people are making resolutions and trying to get their health in order. So I couldn't think of anyone better to welcome the new year than you. And for a number of reasons, probably the primary reason is because you are the new chair of Community Partners for Better Health. The organization has been around for quite some time, and you've been a part of it much longer than me. And so to have you leading in the new year, I think is something that our community is really going to appreciate and benefit from. So I just want to say thank you for joining in this way.
Well, thank you all for the honor of recruiting and asking me to serve in this role. I have to say I have pretty big shoes to fill. And in saying that, I also want to pay tribute and recognition to my friend and the former chair of Community Partners for Better Health, Celeste Fomar, whose energy and passion for community health and all things health, frankly, will continue to be a guiding force for all of us as we move forward in both hosting of this radio show and for me in trying to guide Community Partners for Better Health into 2021 and beyond.
Absolutely. Celeste is still a huge influence on what we're doing, and she's always in our hearts. And the foundation that she laid is strong. So best is still yet to come, right?
This is so true. And so the radio and KCEP specifically has always been a place where people in the Las Vegas community can come to for valid, up-to-date information and education on health and well-being. And Community Partners for, wow, I know it's been at least a decade, if not more, has been really blessed to be able to serve the community through the radio and by having the Southern Nevada Health District host us to do so. So we can provide information and education to the community on KCEP, which is probably the best forum out there for getting the information out.
Yeah, we love our partners here at KCEP. It is such a vital attribute for the city. Having this voice where the people have the voice, I think is really powerful. So just shout out to the radio station here.
There you go. There you go.
Charlene, so I want to, before we get into, community partners and all of that, and I know you've been on the show many times, but just help the listeners, and I guess this year we're doing viewers too, but help them to understand your work and what you do on a day-to-day basis.
Wonderful. My pleasure. So I am the Executive Director for Education for Quality Living, which is a woman-owned, Nevada licensed health promotion and disease prevention program. And essentially what we do is provide consultation to organizations and individuals, oftentimes nonprofit, but sometimes for-profit organizations who want to design or evaluate health promotion programs. A good example might be one that you all know I'm doing with Community Partners for Better Health, which is Reality Tour. And I'll talk a little bit more about that as we go on, but that is a substance misuse prevention project. And so one of the things I did was both identify the need. We know that we needed substance abuse prevention programs, especially now in the era of COVID. So we had a need, and the funding mechanism was there through the PAC Coalition. So we wrote a grant so that Community Partners could use its considerable outreach to the community to be able to bring a program which heretofore did not exist in the state of Nevada. Likewise, so for Education for Quality Living, we have designed, many of the listeners are familiar with Body and Soul. So that's a program that's in a lot of the faith-based organizations here. And it's designed specifically, it was designed by African-American staff at the American Cancer Society, at the Centers for Disease Control and Prevention, and at NIH. And this was way back in the late 1980s, who were looking out at the landscape of populations and realized that there were people who were being missed, and that we were seeing numbers of increased things like cancer. And in some instances, those increases were things that we can control. There's actually some things that we can do to control what we call the incidence and the prevalence of cancer. And some of it has to do with what we eat and how we move. So Body and Soul was actually designed by those African-American staffers in those three organizations to try and reduce the rates of incidence and prevalence of cancer in African-American communities. So Body and Soul, which is a program I brought here to the Las Vegas community, is done in faith-based organizations. And it's about one thing. It's encouraging you to eat more. Now, I know, well, you're probably saying eat more. That doesn't sound consistent with what we normally say. But in this case, it's eat more fruits and vegetables. So we're trying to get people to eat more fruits and vegetables so that they can decrease their incidence of things like cancer or things that we can control through our diet. We also have enhanced the program a little bit in many of our faith-based communities here in Las Vegas to include a physical fitness component. So we want to get you moving. So whether you see us out there doing the dances of the month, or you see us out there demonstrating wonderful food and cooking techniques to get you to eat more fruits and vegetables, that's what Body and Soul does. That's a pretty good example of the kinds of programs I design for communities.
Well, that's important. And we of course, we like our soul food, but there's some soul food that is actually healthy. And there are ways we can prepare our foods that are healthier. So while we're on the subject, what are some things that you would hope to see happen for people this year in the community around their health? Because one of your taglines is that wealth is health. So what are some things for this new year that you'd like to see happening?
Well, for sure, we need to get our hands around some things that I think that one of the things we've been doing with Community Partners is to actually bring in some mental health component. And, for a long time, we didn't really talk about or do, mental health issues in our community. And that is passé. That is very old time. We now understand that mental health impacts our community as much as it does every other community. In many respects, even more so because of the stresses of just everyday living. Now, here's the kick. Again, trying to do things that are a little bit differently. We didn't seek to go to just any community. We sought to bring this program to the faith-based community.
Well, that's incredible. And our community needs this so much. And I'm so grateful for the work that you're doing. in our community, because sometimes we don't know what's out there and we don't know what we don't know. So organizations like the one that you lead as executive director, as well as Community Partners for Better Health, really help connect those pieces. And now with this radio show in particular, everyone knows we always have a theme every single month. Of course, this month we're doing it a little different because it's our first one of the new year. I'm the new host, so we're doing things a bit different. But there's always a theme. Where does that come from?
Well, there is actually a calendar of national health observations. So let's say, and it's actually produced by the federal government. Let's say many of us are familiar with the fact that we address heart issues, right? Healthy heart issues in the month of February. Well, that's also the month of Valentine's Day. So it makes the link there is quite clear.
So this is something that is national. It's not just something the organization is making up. It's actually like the CDC puts this out.
That's correct. So in non-COVID times, you can be assured that you're going to find programs happening throughout, sometimes at the libraries, sometimes in our recreation centers, sometimes in our schools, and certainly in our faith-based organizations that focus on that health issue of the month.
Awesome. Well, thank you for sharing that with us, and we'll make sure to broadcast where people can find that as well, again, at the end of the program, because I know that at least my interest is peaked. Like, let's see what's coming up next month. Let's see what they're going to talk about. So with that, you had mentioned the reality tours, and that's something that's been happening for a couple of years. Could you just tell us a little bit more about that?
Sure. Now, that is a program that through the work of community partners and education for quality living, we recognized the problem in the community and decided to solve it with something new and innovative. And Reality Tour is a program, an experience that has been done around the country, but never in Las Vegas until last year. And
when you say an experience, what does that mean?
So an experience is something that I think is so suitable for Las Vegas, right? Because we have the Strip, and many people go there for the experience of either gambling or gaming or any number of the different things that happen when you go to one of the casinos. In this case, an experience is the audience. It's not like going to a play, right, where you're passive. From the very moment you enter into the Reality Tour space, you are drawn in as a participant. So Reality Tour is a substance misuse prevention program, okay? And it's for everybody. And really what it does is it shows you a way to foster communication on any issue. In this case, it's on the issue of substance misuse. And it takes you, as you walk into the area that is Reality Tour, you're immediately immersed into the life and challenges of adolescent ages 10 to 18 who has made the decision to engage in substance misuse. And that's the new word. We used to say substance abuse. Now we say substance misuse. And this takes the both parent and child and a group of people in a very COVID safe way into his or her life.
I love that. So it's something that is interactive from the moment you get there, and it brings the community together where really anyone can participate, use their gifts and talents in a way that helps others. And it's kind of fun too, from what I've heard.
It's fun, it's interactive. Imagine from the very first minute, you don't even realize that you're in it and you're already in it and you're experiencing it. And you may be, as a participant, you may be tasked to do something in the process. So it really is. It's approximately an hour and a half of full-on fun, engaging. I will tell you that a lot of times people say, they walk away, and we have notes from our premiere, which we did in November, and then our pilot, which we did in the previous June, in which people said, oh, I didn't think that this was going to be any fun, and it was the best thing I ever did. So
I'm so glad to hear that, because it's such an important thing. And I'm also glad you clarified, because you mentioned substance misuse a couple of times, and you indicated that that's what we now use for addiction. So I appreciate you bringing that out. Can you talk a little bit more about why the term has changed?
Well, first of all, it stigmatizes people, and we're not about stigmatizing. But in this particular instance, and again, this grant is funded by the PAC Coalition here in Southern Nevada. But in this particular instance, I think it's so important because people see the term substance abuse, and they automatically feel, oh, that's not for me. My kid doesn't do this, or we don't need that kind of program. And especially when we ask for volunteers, oftentimes we find that people think, oh, well, yeah, but I don't have any problems with that. But that's exactly the point of prevention. We want you to come so you can learn about it, so you can educate yourself and educate others. So in this case, by saying misuse, we're telling you that sometimes people consciously or unconsciously, and we have lots of examples of that, we have people who may misuse a prescription drug, for example. So when we use the term addiction, it really does have that negative connotation, and we're trying to get away from that.
Yeah, and in our communities, a lot of times we've done a really poor job at helping people that need help, because we just write it off as, oh, that's just what they do. They just drink, they just like to have a drink, whatever it may be, not understanding that they could actually get help and live healthier lives if they went through something like this and the other programs that PACT, was another wonderful partner, does offer. So in our last few minutes together, I just want you to encourage the audience to get involved with Community Partners for Better Health and share with them how that's possible.
Okay, well, thank you for that opportunity. So as the incoming chair, I come in with a lot of energy and enthusiasm, and we have an incredible board that we are looking to also expand. So there are so many opportunities to get involved with community partners. Some of the things that we've done annually, and we hope to continue, that your listening audience may know about, Will, is the annual awards luncheon. So in this time, more than any other time, this awards luncheon has always been about people who have been involved in the health arena. It's an opportunity for us to take our caps off and say, thank you very much, and to acknowledge and to recognize and pay tribute to those people who are doing the hard work. So starting in February, we're going to be asking the community, which is you all, to let us know who are some of those heroes and sheroes that are doing the work of public health that we should be recognizing. So if they tune into our radio show in February, but if they start looking at our website, they'll be able to nominate somebody, and that's exactly what we want. Likewise, we're going to continue to do our programming, and we're going to continue to look for programs that are relevant to the community. So I've mentioned Reality Tour, but we are constantly asking the community, what is it that you want? So the community plays such a big role in helping us to shape the kind of programming that we do in Community Partners. So either by participating in our annual needs assessment survey and telling us what it is you want, maybe by coming to our meetings, which are open, and we're going to be having a Zoom meeting, which everybody can come and learn more about what Community Partners is doing and how to get involved. Because it's not just about the organizations, right? So Community Partners is made up of 4 different segments. We're made up of we mentioned earlier, faith-based organizations, but we're also made up of organizations like the one that you work with, Will, the Nevada Lung Association. So all of the associations that are doing the hard work out here, all of the individuals. So we're also made up of individuals who may be associated with an organization, but sometimes just because they're passionate about public health themselves, they are an individual who has an individual membership in Community Partners. Through this first quarter, it's going to be free, because nothing is really free anymore. But through this first quarter, membership in Community Partners for Better Health is free, and there's no reason why you shouldn't jump on board.
Wow. So they can join, and there's no cost, but it's just joining people. So it really is community partners. So they're partnering together.
That's right. And that's so we can address the needs of the community.
I love it. So Charlene, thank you so much for your time this morning. I'm so glad you could be our first guest of the year. Welcome again as the new chair for Community Partners for Better Health. And we'll have to have you back on the show to tell us how everything has turned out at the end of the year.
I will do so. And thank you so much for having me, Will.
Absolute pleasure. Our next guest is Alisa Howard of Minority Health Consultants. She'll be sharing more information with us about the flu vaccine clinics that are happening right in our community. And she'll share a few stats about the flu as well, because we need to know why this is important as well. So welcome to the show, Alisa.
Thanks for having me, Will. I really appreciate it.
Yeah, and you're no stranger to KCEP in the audience here. So just consider this like being at home.
Yeah, I was just on another show a month ago with AK and Professor Knight, Craig Knight and Lou Collins. And so, yeah, I'm glad to be back.
Awesome. Well, again, we're talking about the flu vaccines, and you know how we are. We have a lot of questions about it. Why should we get it? What does it do? But I want to start with really understanding the benefits of getting the flu vaccine, particularly right now since we're in the midst of COVID.
Yeah, so what we're doing is basically getting out to the Black community. Again, as a public health professional, and you as well, you know that our community is really hard to get information into, but also we usually have trouble getting access to health information as well. So there's a two-pronged thing happening there. And so the person that I am, I want to bring that information to the community. And so I'm setting up flu clinics around certain populations, certain zip codes that the CDC has identified through the state of Nevada that are priority zip codes. And those zip codes are low income, have a lot of social determinants of health, transportation, education, things of that nature. And so we're targeting those communities so that we can bring that health access and information about the flu into those communities. And so it's really important for people to understand that getting the flu vaccine, especially now, it's something that we do every single year, right? Most adults, as they get older, they start getting it if we're not already getting it as a young adult. But it's something that we need to continue doing, especially during COVID season, because of the fact that if you get the flu, CDC is estimating that your susceptibility rate to get COVID actually increases. And so,
wow, really?
Yeah. And so with the Black community, being disproportionately affected by COVID, it's so important for us to take care of what we can take care of prevention wise, right? So that if we did happen to get COVID, hopefully we do not, that it will not take such a hard hit on our bodies. Those are two different viruses, and they can really just cause havoc on your body. We already know what COVID is doing, but the flu can actually make it worse.
So why are people so hesitant to get this vaccine, particularly, in the midst of this pandemic, when we know everybody knows someone that has either gotten COVID or passed from it or been really sick? Why is there still this hesitancy around it?
So because flu season happened right in the midst of COVID-19, I think that's the hesitancy, right? One, there was already a hesitancy happening with COVID-19 because of the fact of the disproportionate rates that we have with every disease, right? High blood pressure, diabetes, things of that nature. And then having the history of trauma in our country that we have when it comes to medical trauma, that now a pandemic happens, right? And now they're pushing a vaccine. And then we have people saying, give it to the Black people first, when we're like, hold up, we don't even trust you yet. We don't even know what this really is. So from a public health level, I understand the hesitancy, but also understand how viruses work because that is my background in infectious diseases. So I just think it's really important for us to be educated, right? I think that's really what the problem is that there's not a lot of education happening around COVID-19. It's just pushing, like, hey, get the vaccine or there's going to be a vaccine. And then when it does come, get it. And it's like, wait, what is COVID-19? We haven't done the due diligence in the Black community first. How does the virus work? What is a virus, right? We need to take things back to virus 101 or in public health 101, because the community is at the community level, whether they're educated, whether they're not, whether they're pastors, whether they're just, secretaries, whatever the case is, they're not studying public health the way that we are. So my goal has always been education first.
Yeah. And since you bring that up, I just want to reiterate what you said. The flu is not COVID-19. They are two different viruses. So you need both vaccinations.
Yes.
And it is safe to get both, right?
Yes. So yes. So the flu vaccine we've been getting for years, since 1918. Think about the Spanish flu. And every year it changes and people question that. Why does it change every year? Well, viruses mutate. I'm a specialist in HIV and STDs. We know that viruses mutate. And so the flu virus is a virus of its own that happens every single year, but every single year it tweaks just a little bit. COVID-19 is part of the SARS group, where we saw SARS-1 before, but we've never seen SARS-2, which means that COVID-19 has mutated into its own thing separate from the flu. And so what we need to know in the BIPOC communities is that these are two different things happening, and two different things that are disproportionately hurting us and killing a lot of Black people. I just want to give a little stat here. CDC estimates that from October 1st of 2019 through April 4th of 2020, there were 30 million through 56 million flu illnesses. And then as far as death, 24,000 to 62,000 flu deaths just in that time period alone. And that's not even a full year.
Wow.
Yeah. So that speaks volumes.
It really does. So get your flu vaccines, and it's not too late to get it. You're just in time. So you're doing the flu clinics. Where are some of the places people can go to get the flu shot?
And so what's happening is that the health district is working with Immunize Nevada. They're our main immunize organization in the state of Nevada. Immunize Nevada. So there's like 3 different parts happening here. I'm helping and then go through the health district, and then they go through Immunize Nevada. And what I'm doing is I'm reaching out to different churches. So right now we have a church, Fame, which is First AME, which is on Revere Street. Next Thursday from 9 a.m. to 12 p.m., there will be a flu clinic happening. And these are happening, I'm not the only person setting these up, so these are happening all around the city at different churches, different organizations, a lot of happening in the Hispanic community, a lot are happening in the Black community. So you might even come out of your grocery store and see a flu clinic set up. And what that means is that you'll see Immunize Nevada's tent, and they'll just be standing there with their gear on, of course, offering the flu vaccine, because that's how important this is during COVID season right now.
How much does it cost?
Nothing. So these are free. These are free clinics. If you do have insurance, they would like to take that down and notate it, of course, so that they can possibly bill your insurance if they can. But if they cannot, they are not turning anyone away. And that's the beauty of all of this. These things are being offered free, and Medicaid and all these other insurance companies are picking this up. And so they're really just trying to protect the community right now.
That's fantastic. So free, it's accessible. There's no reason not to get it, is what I'm hearing you tell us. Is that right?
Yes, it is safe. We've been getting the flu shot since 1918. So I would like to just put it out there that people need to, if they feel like they need to be further educated about the flu, they can contact me. I am doing presentations for the community. If they can get a group of people together, even if it's just their family members, and they're going to be sitting in their living room, I will get on and do a flu presentation for them, just to provide that educational piece so that they can make a informed decision. It's not that I'm pushing this on anybody. I just want people to make informed decisions on their own once they have the information.
That's right, because education is power, right?
Yes, it is. And so anyone that wants a flu clinic, if a church or organization sees this and they would like for me to set that up for them, they can contact me at 702-674-6282 or email ah@alisahoward.com.
Give us both of those one more time.
That's 702-674-6282 or ah@alisahoward.com. That's my email.
Perfect. Well, Alisa, thank you so much for joining us this morning. We are so appreciative of all the work you are doing in our community and that you have been doing right here in Las Vegas for years. You are a trusted voice, and we just appreciate your care about us. So thank you.
Thank you, Will. I really appreciate that.
This has been the Healthier Tomorrow radio program. It is brought to you by the Office of Chronic Disease Prevention and Health Promotion at the Southern Nevada Health District. The flu can be a serious disease causing missed work or school, hospitalization, or even death. Getting a flu shot is one of the best ways to protect you, your family, and our healthcare system. It's not too late to get your flu shot. Find out where you can get your flu shot by visiting immunizenevada.org today. Again, that's immunizenevada.org. A special thank you to our guests, Alisa Howard and Charlene Day, and to the Health District for their continued support of this vital voice in our community. I want you to know that you are not just a drop in the ocean. You are the entire ocean in a drop. So keep shining, keep smiling, keep sharing kindness and compassion. And until we meet again, I want you to be well.